This is my concept map for a 72-year-old woman who has been admitted to the emergency room with shortness of breath and edema. The patient is unable to lie down flat in bed. She is required to sit up upright in her recliner so that she can breathe more easily. The nursing diagnosis is ineffective breathing pattern related to heart failure as evidenced by shortness of breath. And the doctor has ordered for her to receive oxygen titrated to 92% for her O2 sats. Right now, she is currently at an O2 sat of 90% with oxygen, and she is still continuing to have shortness of breath, which started with shortness of breath with activity, and now even at rest, she continues to have shortness of breath. So we have nursing interventions which we would like for the patient to do to help decrease her shortness of breath as well as to eliminate the edema. So requesting that she, when sitting, keeps her feet elevated to reduce the swelling. She has also been ordered by her doctor Lasix via IV push to also help decrease blood pressure as well as to reduce swelling. So we have some patient teaching instructions that we would like her to do, such as dangling by the bedside before getting up to prevent orthostatic hypotension. We don't want the patient to fall, so we are maintaining safety at all times. Other interventions is the patient outcome is that the patient will report ability to breathe comfortably following pure sleep breathing exercises. And we have instructions on how to teach pure sleep breathing as well as deep breathing and coughing exercises, and to minimize activities while the resident is having difficulty with breathing and shortness of breath. So here we have the patient's problems. If you flip this up, you see that the patient is sitting in her recliner sleeping because that's the only way that she's comfortable. And she's a 72-year-old recent widow. She's been a widow for 3 months. And we are also looking out for her psychosocial and monitoring her for signs and symptoms of depression. She has difficulty sleeping in her bed due to the shortness of breath. She's also gained 3 pounds. She's gained 6 pounds in 3 days, and she presents with edema in her lower extremities. So we want to get her to a point where she can have a patient outcome where she is able to breathe comfortably and where we reduce the swelling. The doctor has ordered Lasix to be given IV push, and we're also having her, as part of her nursing interventions, we're having her elevate her legs while she is sitting in her chair or while lying in bed. So part of her nursing interventions is to monitor the respiratory rate, the depth and ease of respirations. Also to note the pattern of respirations. Is she having difficulty breathing and dyspnea? Also, we want to monitor her O2 sats as ordered and titrate O2 sats to 92%. We want to have the patient take rest periods before and after activity. And we also want to have patient perform pure sleep breathing exercise. We will teach her how to take a deep breath in and breathe out through pure slips. We're going to encourage the patient to do coughing exercises. In the process of doing these, we are going to monitor her for the presence of pain, and we're going to medicate accordingly. These are her patient-centered goals, that she will demonstrate effective lip breathing and controlled breathing. And she will be able to use relaxation techniques while hospitalized. Part of the patient teaching, which is also part of her orders, is to limit the fluid intake to 2,000 mLs PO daily. We want to use the call light. We want her to use the call light when needed. So we're reminding her here to use her call light. And we also want her to not forget to don't add salt to her food, to limit her sodium intake. That's going to help to reduce the swelling. And this is a reminder to do pure sleep breathing and coughing exercises to help with her shortness of breath. We also, for patient safety reasons, which is very important, we're reminding her that because she's on Lasix, which is going to reduce extra water in her body that's causing the swelling, we want her to be careful when trying to get up or ambulate to go to the bathroom, because this medication, it causes excessive urination and it also decreases blood pressure. So we want her to sit at the side of the bed before ambulation, and if she's dizzy, to call for help. Here are her goals: to breathe comfortably, to do deep breathing exercises and coughing, and to schedule her activities and take rest periods. Another goal is to reduce the edema in her lower extremities. So we want her to elevate her feet when sitting in the recliner and offload her heels when lying down in bed. If the patient does comply with her medical regimen and her nursing interventions, her treatment will be successful. And here, this is her to do, and that's what we like her to do, to follow her medical regimen and nursing interventions to ensure treatment is successful. This will be her patient outcome. After nursing interventions and medical treatment, a hair color treatment along with Lasix, she will feel like this. This is how she started off, and this is how we would like for her to feel before she is discharged home. So with discharged home, we have some important reminders for her that because she is on Coumadin, and we want her to ensure safety at all times, she is prone to bleeding and bruising, so we're reminding her to use a soft bristled toothbrush and to alert the doctor or dentist that she is on Coumadin before any procedures. We'd also like for her to remember to avoid foods that have vitamin K because they decrease the effects of Coumadin. It is the antidote. So, for example, green leafy vegetables. We don't want her to have these foods that have vitamin K because they will decrease the ability of the blood to thin out, and she will be prone to bleeding more. That concludes my demonstration of my concept map of my patient, the 72-year-old widow times 3 months, who is now in the hospital with ineffective breathing pattern related to heart failure as evidenced by shortness of breath. Thank you very much for viewing, and have a good day.